So essential training. This really refers to any training that prepares you for a care or support role. And some of this will be provided by your employer. But if you demonstrate you have undertaken training before you apply for a role, it might improve your opportunities and chances of getting a job significantly. Many of these training pathways will be required on an annual basis, and that's part of continual professional development, or CPD. And this is dependent on your employer's requirement and policies. So, for example, safeguarding, first aid, CPR, moving and handling, they all form part usually of an annual in-house CPD training. But the above will all be covered within South London College courses in theory. For example, level 2 in understanding dignity and safeguarding in adult health and social care, courses like that. So you will find, if you undertake an adult care course, that these are covered, but the practical aspects will be covered during your training in your role. Because, for example, for CPR, you really need to understand, yes, the theory of it, but you need to be able to apply it, as you can see on the model at the left hand of the screen. Practical training is essential for knowing how to apply the theory in practice. Likewise with moving and handling. You may in theory understand how to move a patient from A to B, where to place their wheelchair, how to move them using a moving and handling belt, etc., what to do, how to clean down the equipment, but you also need to be able to apply these to a practical context. And again, within your role, you'll be given many opportunities, and you'll have a mentor or a supervisor so that they can oversee the very first time, for example, you move somebody from a bed to a chair, or from a wheelchair to a chair, etc. So can I have the next slide, please, Noah? Formal qualifications. So we've spoken quite a lot about formal qualifications through the presentation so far. But what if you're just starting out? How do you decide upon the correct pathway you want? So here are some examples of the types of courses you might choose for a continued pathway. A hypothetical scenario, say, of a student just starting out, wants to work with people on the autistic spectrum, but aims to work their way into a management role. So I've just listed here some of the courses that would be applicable to this hypothetical scenario. Care certificate for new starters, for example, South London College Level 2 Adult Care Certificate. Diploma in Adult Care Levels 2 to 5. So as above, plus their Level 3 Diploma in Adult Care, Level 4 Advanced Care Practitioner, Level 5 Diploma in Leadership and Managing Adult Care Services. So again, specialist CPD modules, example, South London College Level 3 Certificate in Understanding Autism. So all of these you can see, you can track this, so you're starting out and you're working towards your final goal. So again, plan out your hypothetical pathway for qualifications, but think about your end goal. Perhaps do an action plan again where you've got short, medium and long-term goals. Look at the skills you've already got. Have you undertaken courses already? What are your short-term goals? How will you achieve it? What are your medium-term goals? How will you achieve those? And your final long-term goals. How much time do you think it will take you to reach those goals? What do you need? What will you already have? What are your timescales? Are there any barriers to you meeting your individual goals? So it's quite useful to jot this down on paper so that you can check off when you've achieved something. You can adjust your goals if you change your mind. And if you need some guidance, do talk to a college study support advisor who can perhaps help you decide which course to start with and make your plan. Could I have the next slide, please, Noah? So career pathways. We've spoken quite a lot about different levels, but I'll go through some of the examples on the levels here. So an entry-level role, example, level 2 care assistant, healthcare assistant, support worker, and these involve direct and personal assistance. For a senior care worker, which is level 3, your key responsibilities involve developing and monitoring care plans, overseeing shifts, responding to emergencies, and communicating with families about resident progress or client progress. This role also requires you to undertake administrative duties like record keeping, medication administration, and creating engaging activities for residents if you're in a care home setting. For a team leader role or a care manager, you will probably need a level 4 or 5 diploma. A care manager oversees a care setting's overall operational from day to day. It includes strategy, budgets, quality of care, dealing with things like CQC visits, who will visit a care home and grade them, etc. Now, a team leader focuses on the day-to-day guidance and support of the care staff, and they report to the care manager, so you can see the hierarchy here. Their roles can overlap, so if a care manager is off, a team leader might take control if they're on holiday, etc. So they're very close in roles, but there is a subtle difference. The care manager has overall charge and probably doesn't have a lot of hands-on day-to-day contact with clients, whereas a team leader will, because they will be supervising, for example, new people who've just entered the care team, etc. So they will have more of a hands-on. So you can see there's differences, and the levels you will need pretty similar, level 4 or 5. So beyond this, you might think, well, I've gone through these roles, but what I really want to do is go into nursing or other healthcare routes. So for nurse training, it most commonly involves a nursing degree, which can be a 3-year undergraduate program or shorter postgraduate degree for those of you who have a prior relevant bachelor's degree. Other routes include nursing degree apprenticeships, which are typically 4-year programs, and they lead to associate levels like nursing associates, which combine academic work and work-based learning. Entry requirements for degree courses generally include several GCSEs, maths, English, science, and at least 2 A-level or equivalent qualifications. Equivalent qualifications are things like access to higher education qualifications. You can pursue nursing training with prior learning through programs like accelerated degrees, as said, apprenticeships that recognise previous learning. And this is formally called Recognition of Prior Learning, or RPL. So if you're thinking about that and you're looking at courses, look for that. Or it might say Accreditation of Prior Experiential Learning, so APEL. So if you've had lots of experience in working in the care sector, that might be something to look for. And it can also reduce your time and cost of your degree. So to qualify, you've got to produce evidence of your previous theoretical and practical experience, which is then formally assessed by the university against the nursing programme outcomes.